Hi, everyone. Thanks for joining us today. My name is Liliana Bolaños, and I am the Immigrant Family Policy Analyst at Voices for Utah Children.
Hi, everyone. My name is Sirek Alvarez Valle, and I'm also an Immigrant Family Policy Analyst at Voices for Utah Children. And today we are going to be discussing HR1, the One Big Betrayal Bill. Today we really want to go through how HR1 will impact Utah's immigrant families. And we're going to, go through today's slides and hopefully share as much information as we can about the bill and its impact.
So we're going to start off with some grounding, and I'm going to read this slide. It says, "We recognize that the changes we will be discussing will have a profound negative impacts on communities we care about. Behind the numbers, funding cuts, and data are impacted communities, and we wanted to take a moment to recognize that and thank you all for the care you put into our communities and the effort to keep pressing forward."
So for some context, Utah has approximately 304,000 immigrants who call Utah home, and more than 181,000 U.S.-born residents that live with at least one immigrant family member. HR1 was signed into law on July 4th of this year, and most of the changes reflect a larger alarming trend of immigrant exclusion policies, both for undocumented and legally residing immigrants, to remove their access to programs and services that a lot of these families rely on. This legislation, however, won't make us safer. It'll increase our number of children in poverty. It weakens our Medicaid system and takes away coverage from thousands of children and families and leaves children and families more hungry and shifts the cost of all of this to states. One thing I wanted to mention before we get started is just some context of how we got here. Traditional right-wing media outlets, including Fox News, The Daily Caller, and Washington Examiner, played a huge role in exposing anti-immigrant message in 2024, which increased by 146% compared to 2023. Between January and October of 2024, the Immigration Hub found that right-wing media produced 43,000 negative immigration mentions, which generated over 176.4 billion impressions and an estimate of $5.5 billion in publicity value. I share this to shed the light on what's helping drive the rhetoric post-election into this bill and how many of these provisions were based on continued anti-immigrant messages that started in late 2024. Today, we're going to break down the following areas and share important details for each of these. We'll be talking about the child tax credit restrictions, the healthcare restrictions, immigration and enforcement and fee changes, and SNAP restrictions, all of which will impact immigrant families.
Thank you, Sidiak, for that context. So we'll get started by talking about changes to the CTC, or Child Tax Credit. So effective tax year 2025, individuals will not qualify to get up to $2,200 per child with the child tax credit, even if the child is a U.S. citizen. The child and at least one parent must now have a social security number. So even though this child is a U.S. citizen, as you can see here, there is a new requirement that requires at least one parent to also have a social security number in order for that parent to qualify for the CTC through their U.S. citizen child. Let's talk a little bit about the impact that this will have on Utah. In Utah, 9,262 ITIN children will be excluded in the 2017 or have been excluded with the 2017 Trump tax bill. 26,900 citizen children with only an ITIN eligible parent or parents will be impacted by this. And again, an ITIN is an individual tax identification number, which allows an individual who is not eligible for a social security number to pay taxes. So this is how many U.S. citizen children in the state of Utah will be impacted by this change. And then 36,162 is the total number of children impacted by CTC exclusions. And then a potential budgetary loss to state in the first year is an estimated $79,556,400. So just a little glimpse into how this change will impact not only the individuals and families in the state, but also financial impacts to the state as well.
Thank you, Lily. We're going to next talk about the healthcare impacts. So the bill makes major changes to Medicaid in general. Some of these include having lowering the amounts that states can collect in provider taxes, adding work requirements for many adults in the Medicaid expansion program, delaying some of the rules that make it easier to apply and renew coverage. And it also limits how far back people can get the retroactive coverage and requires more frequent eligibility checks, among other provisions. If you want to learn more about all the healthcare provisions in general, feel free to scan this QR code to learn more about how it will impact low-income Utahns. However, the next healthcare changes that we'll share will directly impact immigrant communities. So the first restriction that we want to talk about is the removal of premium tax credit availability during periods of Medicaid ineligibility due to immigration status. So lawfully present immigrants right now with household income less than 100% of the federal poverty level who aren't eligible for Medicaid because of their immigration status will no longer be eligible for premium tax credits starting January 1st of 2026. Locally, what this means is that right now the average monthly premium for those who are currently eligible for this tax credit is $52. However, the average increase in monthly premium for those who will lose access to this will be $462. We know this is a steep change and hope that we can, one, continue sharing more information about other opportunities or other resources that are available for immigrants who are in this situation, and continue advocating for these tax credits to be returned. The second provision we want to talk about is the elimination of the FMAP for certain emergency Medicaid recipients. So effective October 1st of 2026, there will be a limit to federal matching payments for emergency Medicaid for individuals who would otherwise be eligible for Medicaid expansion coverage, except for their immigration status. So this means that we will lose federal funding for emergency services for around 1,100 people. However, this doesn't mean that these people will lose coverage or will lose access to emergency Medicaid. It means more so that we won't receive as much funding from the federal government when these clients are seeking services through emergency departments. However, again, people can continue accessing emergency departments even if they are under this umbrella of who they are. The next healthcare restriction we want to talk about is the largest one, which restricts who qualifies for healthcare because of their immigration status, because there will be less federal funding. So this piece, effective October 1st of 2026, amends how much funding a qualified immigrant receives federally, who receives the Medicaid and CHIP federal funding. And so it restricts those who will be able to receive federal funding from all of these groups to only lawfully present residents, certain Cuban, Haitian entrants, and COFA immigrants. For refugees, humanitarian parolees, asylum grantees, certain abused spouses and children, trafficking victims, and other non-citizens will no longer be able to receive federal funding, and so we will see limits and restrictions on those folks being able to access coverage. So in Utah, that'll mean that we may have a reduction in the number of Medicaid and CHIP clients by approximately 5,400 individuals.
Now we're going to talk a little bit about the immigration enforcement piece of this very big and complicated bill. So HR1, this bill allocates 170 billion plus for dollars, sorry, 170 plus $billion for immigration and border enforcement through 2029. This is a lot of money. These are some of the major funding categories that this will go into. So first, detention and deportation. They are investing about $75 billion into detention, $32 billion into enforcement and deportations. And then as far as border militarization and surveillance, the administration is investing about $75 billion into construction of the border wall and militarization at the borders. Local enforcement support, this means that they are investing about $13.5 billion into state and local immigration enforcement reimbursement. So again, if a state or local city, county invests any money into immigration enforcement support, federally, they will be reimbursed through the funding provided in this bill. Regarding local impact, Voices for Utah Children, we're concerned that increased funding will mean a rise in ICE presence and 287G agreements and their negative impacts to family. This summer, Weber, Utah, and Wasatch County have all signed new 287G agreements. These 287G agreements are essentially contracts between local enforcement and ICE, allowing them to collaborate. And not all 287G agreements are one and the same. Each contract looks different. And that's a conversation for another time, but it is very important to understand exactly what the 287G agreement in your city or county look like, and to speak to local officials to understand exactly what that means for your city or county. And as you can see here, Fox 13 News Utah provided this map showing what some 287G agreements look like specifically in the state. There have been changes since this map was released, but currently 11 counties in Utah have a 287G agreement. And then continuing on the immigration enforcement piece on this bill, there are specific measures that target children that we're very worried about. HR1 includes policy measures that undermine due process and target immigrant children, such as the bill approves long-term family detention, violating the Flores settlement. This funds intrusive physical exams of unaccompanied minors, including very young children without age limits. It also implements extreme vetting of child sponsors and household members of unaccompanied minors, which is more than likely to discourage sponsorship of unaccompanied minors. And then it also allows rapid deportation of children without legal counsel or court access, undermining due process. For the sake of time, we can't dive into the specifics of all of these, but feel free to look into our source here at the bottom to learn more. But essentially, our concerns are the rights that are violated here and the lack of consideration for the minors going through immigration court proceedings. There have also been some changes to immigration fees. HR1 creates new fees and dramatically increases others for certain immigration applications and forms of humanitarian protection. And here are a few examples. So the asylum application fee, it is a fee that is required when filing an I-589, which is the asylum application. The Previously, this was free to file, and now there is a $100 fee, and there is no ability to waive this fee, as well as temporary protected status, or TPS, another type of temporary humanitarian visa. The fee for registering for TPS was originally $50. It is now $500, which is quite a significant jump. And again, no fee waiver. Special Immigrant Juvenile Status, or SIJS fee. This is an immigration status that minors can apply for if they have been abandoned, abused, or neglected by one or both parents. This used to also be free to file and is now $250. And individuals may request a fee waiver. And then there's also a parole fee increase here. The minimum non-waivable fee of at least $1,000 for anyone entering the U.S. under a temporary permission to enter the country, usually on humanitarian grounds. So this used to be $630 and is now at least, so the minimum fee is $1,000, and some exceptions are provided. I think the key here is that these are all humanitarian visas, so individuals entering the country in very vulnerable circumstances that oftentimes may not have funds to pay for a lot of these petitions. And so it just highlights how unfair and cruel a lot of these fee increases and new fees are, considering how the vulnerable positions that a lot of these individuals are in at the moment of entering this country, surrendering at the border, or whatever that may look like. So we definitely have concerns about these fees and how it could impact individuals seeking humanitarian benefits in the United States.
Thank you, Lily. The last piece that we wanted to talk about is the restrictions for SNAP. So there was no effective date specified for the SNAP restrictions. However, what will happen is that there will be limits on SNAP eligibility due to immigration status. So SNAP eligibility will be limited to U.S. citizens or U.S. nationals, legal permanent residents or green card holders, immigrants who've been granted the status of Cuban and Haitian entrant, and individuals who are lawfully residing under the U.S. accordance with the Compact of Free Association between U.S. and Micronesia, the Marshall Islands, and Palau. This means that essentially it ends SNAP eligibility for refugees, people granted asylum, certain victims of labor or sex trafficking, certain victims of domestic violence, and other currently eligible immigrants who have a lawful status. So while Utah must wait on guidance from the Food and Nutrition Services before they implement this policy, we do have some estimates of what the local impact will be. So approximately 3,000 immigrants may be impacted by this restriction, and we may lose approximately $12 million from excluding refugees and asylees from SNAP in the first year. And this is because SNAP helps our economy. So when someone buys groceries, when farmers make food, all of these like different interactions bring more money to our state. However, with less money to families, this will mean that there will be less money in our economy. According to national statistics, about half of the people who are on SNAP are children. Almost half of all households utilizing SNAP, have children. And nationwide, refugees and asylees are now who are now currently ineligible for SNAP under the bill. About 40% of refugees and asylees who were admitted or resettled in the last year were children. So we know that this impact will not only impact adults, but it will impact a lot of children and families throughout our state. And again, we'll continue to advocate for this to be reversed and really try to do as much as we can to share information about other local resources that will be available for those that may no longer be eligible for SNAP, or if they are eligible, may lose funding because a family member is no longer eligible. So when we're thinking about what's next, really we want to think about how we can measure the impact of what these restrictions and changes will mean for families and how they will impact not only individuals and not only individual families, but really our community and economy as a state. And any way that we are able to measure the impact will be really important as we advocate for change in policy and advocate for reversal policy in some cases. The second thing, of course, is informing families of what the changes ahead will look like, because we know that families being prepared and having all the right information to make the best decisions for their families looking ahead will be really important. And then the third thing, of course, is sharing alternative services, supports that are available through our Utah Immigrant Advocacy Coalition, the u-iac.com website. We try to share as much resources, programs and services that are available to immigrants and according to different statuses. And then, of course, the last thing that you all are doing, which is staying up to date on what the new guidance looks like. We know that these next couple of years will be really difficult for a lot of immigrant families. And so we will do our best to advocate for a Utah that is welcoming for all and really continue to share information as we get it. And then, of course, looking into different policies that will make us safer and make our state better. We have come to the end of our presentation and just want to say thank you on behalf of Voices for Utah Children for being here. This is our contact information, mine and Lily's, and always happy to share anything else as you all continue to do the important work when it comes to supporting immigrant families in our state. Thank you.